Hey guys, welcome back to the channel. This is Pawan. I'm a registered nurse working in emergency department of one of the hospitals in Sydney, and we get nursing students all the time. I have been butted up with quite a few of them over the years. Some were great and some left a little bit room for improvement. And in this video, I'm going to share with you how to succeed and get the most out of your clinical experience as a nursing student while you're on your placement. So let's get right into it. Okay, so let's start with super basic first. What do you actually need to bring to your clinical placement? Well, you obviously need your outfit, your uniform. You will need a stethoscope because it's really handy to have your own stethoscope and you're not going around the department every time you have to do like a set of vital signs. A pen. How many students I've seen coming to clinical placement without a pen? I mean, what are you going to do for the whole shift without a pen? So a pen would be handy. What else do you need? You also need a fob watch, like a nurse's fob watch that can be attached to your uniform with a safety pin or something, because you're not actually allowed to wear your wristwatches at work because of, infection control. So a fob watch would be very handy, especially when you're doing your vital signs. What else? I've actually seen a few students bring a medication reference book as well, but you don't actually need it because we have MIMS online, and every time you need to look up an action or mechanism of a drug, you can actually go jump on a computer and go to the online MIMS and actually look it up over there instead of carrying a book around, which is a medication reference book. So you don't really need that. And a little piece of paper or a little notebook that can fit into your scrub pants or whatever sort of pants you're wearing, instead of carrying the big clipboard with multiple pages on it. A little notebook would be handy to keep track of all the new things that you're learning, or even to write down all the questions that you're not able to ask on the spot. So yes, a little notebook would be very handy. You can even just go to Kmart or Typo in Australia, where you can just find these little notebooks for like $1 or $2. So really guys, that's about it. The internet will tell you that you actually need to bring the entire world to your clinical, but that's not true. Nursing school itself is very expensive, so we will try and minimize the cost as much as we can. Okay, so now that you know what you're going to bring to your clinical placement and you're all ready and excited for your very first clinical placement, let's get right into some suggestions that you might need. While most of your time at your clinical placement will be spent learning about patient care, there's a few little things that you can actually do to show your instructor, other nurses, and your classmates that you actually take your role and their time seriously. Now, here's a list of things for you to remember. Firstly, be on time. Treat this clinical rotation as you would any other job. Secondly, be professional. Even though you're a student, this is a working environment, so the basic workplace etiquette still apply. And thirdly, be prepared. Study your patient's charts carefully. So if your preceptor comes around asking you questions about any of your patients, you should be able to answer them. But just in case you didn't know the answer to one of those questions, don't fake it, just be honest with them. Now, before you go for your clinical placement, you need to set the goals for the day. Like today, I want to learn about giving IV medications or doing a head-to-toe assessment or whatever it is that you need to learn. So at the beginning of the shift, when the nurse you're butted up with asks you what your goals are for the day, you have an answer for them. Because, oh my God, so many times I am butted up with all these students and I ask them, is there anything particular that you need to learn or do today? And most of the time I get an answer like, no, I'll just tag along for the day and, look after patients. But you're not helping me by telling me that you need to look after patients. Like, I know you're here for a clinical placement, but if you give me an answer like, I need to do a head-to-toe assessment, or I need to do like a PICC line dressing or something like that. So it's very important to be clear with the nurse you butted up with what your goals are for the day so they can help you achieve them. And also be very clear with the nurse you butted up with about the skills you already have and the things that you are comfortable doing. So the delegation of tasks actually becomes very easier for them as well. And while you're on your clinical placement, be one of the students who's actively participating in everything that's happening around them. Be involved in the patient care, be proactive. And can I just say, don't sit. Unless you're charting or looking up something on a computer, that's fine. But other than that, you should be up and going. You have limited number of clinical hours, so use them. If you don't have any immediate tasks that you would be doing and all your patients are fine, go ask other nurses if they need a hand with something. Answer their call bells, whatever. Just do something. And ask questions. It's simple. The more you ask, the more you learn. So ask as many questions as you can. Doesn't matter how silly you think the question might be, you're there to learn. I know some of you might feel that you don't want to annoy your nurse by asking too many questions, but trust me. While you're on your clinical placement, asking more questions will not only build your confidence, but you will learn a lot quicker too. So don't worry, be that annoying student and ask a lot of questions. Now, going along with some unfortunate situations that might happen while you're on your clinical placement. So what happens when you're a nursing student and there's a code blue or some sort of medical emergency? Now, you might find it very tempting to go and have a look what's going on there. You might find it very exciting, but medical emergencies can be chaotic as they draw a ton of people into this small room. So you might want to step back a little bit and watch from a distance, or even go wander around the ward and see if there's anything you can do for other patients while they are being neglected, while the team is looking after this particularly critically ill patient. I'm not against students learning from these kind of emergencies. I mean, if you really want to watch what's happening, sure, just maybe stand either outside the room or observe from one of the corners, because it's really awkward for us to ask students to leave and then they get offended. There's already a few people in the room and all of them are playing an important role, and it's crowded and chaotic. And in a few years' time, you'll be that person in action doing your own thing, but it's going to be a little while because there's a lot of training that goes into it. So in the event of emergency, just step back a little bit and watch from a distance. As I've been a student myself and I've worked as a registered nurse for quite a few years, I've come across many students, and these are the little things that differentiate them. I know, it's hard being a student, I've been there, but all your little efforts don't go unnoticed. So guys, I really hope you found these tips useful as you get ready to dive into your clinical placement. And if you're new to the channel, make sure you subscribe, as I aim to make videos to make your life as a nurse, as an emergency nurse, as a nursing student easier. And I'll see you in the next video. Bye for now. I know some of you might feel that you don't want to annoy your nurse by asking too many questions. My cameraman is laughing, so I'm laughing.